gone through the prostate cancer experience, most of you have probably heard the term penile rehabilitation. This is the idea that your doctor is going to do something for you to rehabilitate your penis to get it working again. That's a great concept. The problem is there is no such thing as penile rehabilitation. It's a marketing term. There was a study done several years ago by the Sexual Medicine Society of North America. And these doctors went around and collected all this information on what various doctors were calling penile rehabilitation. Guess what? Nobody agreed on what it was. Basically, what they're trying to do is physical therapy for the penis. Your penis does need physical therapy. But let's call it what it is, physical therapy. Penile rehabilitation is this marketing term that doctors use to give you confidence that you're going to be better. Unfortunately, most doctors give you a daily PDE5 pill and say, here's your penile rehab. It's far more complicated than that. Let's go over real quickly some aspects of penile function that will benefit from physical therapy. First of all, we know that lack of use causes penises to atrophy, to shrink. No guy wants that to happen. The most important aspect to prevent atrophy is maintaining good blood flow. If you are not getting erections at night, or even on and off during the day, your penis is not getting enough blood. Without enough blood, there's not enough oxygen. Now, remember this from earlier? This is the little space or the sinusoid or the lacunae that's inside your penis. These are the muscle cells that are relaxed right now, and they're contracted, keeping the blood out. So what happens if your penis is not getting erections? These muscle cells are staying tight like this. There's not a lot of blood getting into these lacunae to feed the cells. Without that blood, there's not enough oxygen. The cells die. So when it comes to physical therapy on your penis, the first thing we need to do is get blood flow. We need to constantly promote blood flow to your penis because blood needs to be flowing to all parts of your body all the time. The easiest way for this to be accomplished is through the use of a vacuum erection device, also known as a penis pump. Now, there are all kinds of penis pumps in the world. The medical ones are great. They'll last you for years and years and years. If you can't afford one, that's okay. Go to the sex shop and buy a cheap plastic one. A vacuum is a vacuum is a vacuum. Your penis really doesn't care how much it costs to get that vacuum. Promoting blood flow also involves stretching your penis. I tell guys every time you go to the bathroom, every time you urinate, you take just a minute and you sort of milk your penis, you stretch it, you try to squeeze some fresh blood into it, you get it loosened up, you get blood flowing in there anytime you can. Also, regular stimulation, sexual arousal is really important. I tell guys if you're not able to have sex, please masturbate probably every other day. You do not have to get to a climax. So it's really important that you get sexual stimulation at least every other day during recovery. In fact, in general. If you're not getting erections, try to give yourself an erection. Now, it gets really difficult if you have a flaccid penis, you can't masturbate in your normal stroking way. Get a good, strong body massager type vibrator. You can get strong vibrators at Brookstone or Sharper Image, or if you go to the FrankTalk website on the marketplace, we have several there that you can buy. These are not the same as sex store vibrators. Most of those are made for women. They're not strong enough for men. Most men need a really fairly strong vibration stimuli on the penis to result in an erection, or at least some inflow of blood. It's also important at the same time throughout all the week you're taking PDE5 inhibitors or the oral ED drugs. Daily Cialis is good. It will not give you an erection, but it will promote blood flow. You can definitely take a Viagra every day or the generic sildenafil or tadalafil. Certainly even a Stendra every day. Anything you're doing that can improve blood flow to the penis is going to help. Now, guys take these pills on a daily basis thinking it's going to result in an erection. It won't. Remember, we're not trying to get an erection with these pills. We're trying to get blood flow improved. If you're not able to get great erections with the pills, you should be using injections at least twice a week. I would go for 3 or 4 times a week, essentially the same rule every other day. It does seem aggressive, but folks, when you've had an injury and you go to physical therapy, they're as aggressive as they can be, staying within the limits of safety and comfort and everything else. All of this should be done with your doctor's approval. Of course, you can't get any of these drugs without your doctor's approval, so be sure to tell your doctor what you're doing. Using the intracavernosal injections to get erections several days a week was really beneficial. And while you're there, have sex, enjoy it. Enjoy the fruits of your labor. Now, when it comes to physical therapy for nerve damage that occurred during either radiation or surgery, it gets a little more complicated. Nerve healing is a long, slow process. However, we do know there are some things that help improve nerve function. Believe it or not, vibratory stimulation on the penis has been proven to stimulate nerve growth. There's a product called the Vibrect. The Vibrect is a caliper with 2 vibrating pads, and you put the penis in between it and you clamp down very gently. And this intense stimulation on both the top and the bottom of the penis really helps nerves function and regrow. The Vibrect is also really good at delivering an orgasm. At a bigger scale, we are looking at healthy diet, healthy living, good exercise. Anything that's good for your heart is good for your penis. Lose weight, stay active. Remember the nitric oxide that causes all erections to start in the first place? If you are obese, if you're drinking a lot of alcohol, a lot of cholesterol, a lot of bad blood sugar, any of those things cause the nitric oxide to be scooped up by other molecules before it gets into your penis to create an erection. And the last thing I tell everyone is don't underestimate the power of human touch. Being touched by your partner, and if you have no partner, please go get a massage at least a couple times a month. I would also ask for them to do a pelvic massage, especially get the blood flowing in your pelvic area. Blood flow is always going to help things happen. But what touch does for us is it relaxes us, it gets the endorphins flowing, it gets all kinds of things going in your body. All of this, believe it or not, is going to help you with your penis. So to quickly review, penile rehabilitation is a great marketing term. It doesn't mean anything. There is no approved system for penile rehabilitation. If we look at it as physical therapy, that gives us a little better idea of what we can do. First, we need to improve blood flow. Second, we need to improve function of the nerves. Third, we need to restore normal sexual functioning with the injections and the orgasm and ejaculation. Even if your ejaculation is dry, we need to get that going again. And finally, overall health is really important to the health of your penis. Mental health, depression, anxiety have a huge effect on your penis. Physical health, obesity, too much alcohol, recreational drugs, or even prescription drugs can harm your penis as well. So we want to take care of your whole body as well as including all of these physical therapy aspects to get your penis to the best shape it possibly can be.